have a little look and see whether there's a better entry point on this study. And actually, this might be a slightly better approach. You can see just down here that there's a nice window to get down. So we're going to select our target point, and I'm just going to have another look. Yeah, I think that's where I would like to finish the needle, and click there. The entry point at the skin is the next selection, and we could sort of head up and make an angled approach, but I think we'll stay on the same slice and set the entry point. And that's quite a nice direction right there. Essentially, this is I think a good case for the ROBIO, because you've got a very tight window, about maybe 1 or 2 millimeters either side, where you've got some space. So having it actually guide us at least to the very target point in this patient was very handy, because you've got perfect angle, you know where you're going to anesthetize, and we had a guide. In this patient, she actually moved very slightly so that we ended up very near that lip, but it was easy to make that adjustment because we already had our perfect angle, so we could just come back, slide in, and I actually do the depth perfectly because the holder was there. So that was actually a good case for me to get used to it, yeah. So drawing up needle.
Yeah, she's getting it already.
Oh, look at me, I'm being demanding here, no good. And that will generate our report for us that we could utilize and transfer to the PAC system if we needed to.
We're here having a video for Anil to blog his ROBIO device in Australia, first machine in Australia at the Alfred hospital. This is a patient who has a nerve root compromised from a disc, and what we're going to do today is put a needle down into the nerve root and inject a mixture of local anaesthetic, which will take out the pain, and a steroid, which will take out the inflammation. This is done to avoid surgery in a patient who probably doesn't need surgery, we just need to get them over the acute episode. This is done in a CT scanner, and the CT scanner shows us the path that we have to get to. The issue with putting needles in CT is that sometimes the path isn't straightforward, and if it's a compound path in terms of going from a different area other than straight above the lesion, you have to come in from an angle, and sometimes it's a compound angle in 2 directions, which is very difficult to visualize yourself. The advantage of ROBIO is that ROBIO works out these difficult compound angles for us. So all I have to do is tell ROBIO where I want to get to and where I wanted to start from, and he does all the rest. He positions himself exactly over the right spot on the skin so I can put in local anaesthetic, and then tells me exactly how far in to put the needle, and I put the needle straight in one swift movement, which causes less pain and discomfort for the patient. And once I've done that, ROBIO's done his job. We then confirm the position of the needle by doing some more CT scans of the tip of the needle, and so far it's been within a millimetre of where we wanted it. It's quite remarkable. It's taken all of the complexity and difficulty out of placing needles and CT anywhere in the body. The procedure we're doing today is a nerve root injection, and it's pretty simple. Some people would say, why do you bother using a robot for this? I'm quite good at doing nerve root injections, but a lot of my registrars struggle with it. And the beauty of the ROBIO EX is that every registrar who does nerve root injections is now as good at doing them as I am. So we've upskilled the whole department just with one device. And as time goes by, they'll become much more confident in using this device. And if they do go to hospitals that don't have a ROBIO EX, they'll still be much better than if they'd struggled for weeks and months trying to learn how to do it themselves without it. I guess the other thing you could say with ROBIO is that this ROBIO family, which is, we have the ROBIO EX model, and there's an upgraded model called Maxio coming, are designed to allow not just simple placements with needles, but to allow complex reconstructions of tumours, segmentation of tumours within the liver and eventually the kidney and probably the lung. And that will allow us to place not just one needle but multiple needles with immense accuracy, without all the time wasting of trying to see where the needle is with ultrasound or CT, or using fusion devices or complicated guidance devices. The ROBIO just takes standard CT scans and has a very simple, straightforward interface to allow you to plan the path of each needle. And it's just revolutionising the way we're doing our CT procedures.